Well, welcome everyone to the Peer Recovery Center of Excellence, NIATx Virtual Change Leader Academy. This is session 2, and Matt and I will be your facilitators. The funding initiative, our grant number is here from SAMHSA. And so the views expressed here today are not necessarily the views of the Department of Health and Human Services, but the views of Matt and I. Just a reminder that we have 4 core focus areas at the Peer Recovery Center of Excellence. So we look at clinical integration of peer recovery support workers, building and strengthening the capacity of recovery community organizations, enhancing the professionalization of the peer workforce, and then providing evidence-based toolkits and resources to diverse stakeholders. And always, if we want addiction destigmatized, we need a language that's unified. And so we never want to describe the people we work with as their disease or their diagnosis. We want to be sure to always describe somebody, well, first maybe ask, and then second, as a person first. Next slide. And then some housekeeping. We love to see your faces. This is a super engaging, the Change Leader Academy is built to be an engaging format. And so if you can come on camera, please do. We understand sometimes you might be in a car or have bandwidth issues and you can't be on camera, and that's perfectly okay. But if you can, turn on your camera so we have the most engagement possible. We will ask you to come off mute and talk whenever possible, and just remember to put yourself back on mute so that we don't hear any background noises. And then always feel free to use the chat to share any of your thoughts or insights or ask questions, and I'll do my best to make note of any questions coming up, so in case Matt doesn't see them. And Great. From here, I'll hand it over to Matt. Welcome. Thank you.
Thanks, Chris. Appreciate that. It's good to see all of you with us again today. And I will reiterate what Chris was saying. I think it's important for us to keep having dialogue and having conversations. So as any questions arise, if you have any questions, concerns, thoughts related to anything that we're talking about, please express them in real time. Don't wait. Tell us what they are, say them out loud or chat them, because that's what's important, is that we know how you're doing as we're doing this, as we're working our way through the material. And we always learn the most when we can talk about stuff together and sort it out together. So please do keep sharing. I want to start by thinking a little bit about what your concerns are, what your ideas are right now when you're thinking about things that you might want to improve. You know, what the issue is, you know, what's the process, who might be the customer. You know, if you, for example, are thinking, well, okay, so maybe we don't have a lot of people showing up for our family programs, and so that's our issue. And then maybe our process is the way we deliver that session or that experience. And, you know, then thinking about who the customers are the customers our the family members, the people who are participants in our services? Are there other customers? So I'm curious, as you all are thinking right now, as we start to look into the next part of the process, which is to think about how to design a change project, and kind of thinking through some of the tools that we use to sort that out. Does anyone have any particular things that they're thinking about right now that are the issue that you'd like to focus on? And here's a little tip: the people who talk about the stuff that they want to focus on are usually the ones who stay the most focused on it as we're working together. So I always encourage people to, you know, kind of state their position if they have one, like, yeah, I'd really like to try to work on this, and here's the process that I'm thinking about, and I've got this particular customer. So I just like to give people a chance to say anything out loud. Is there something that you're thinking about? Like, where would you like to put your energies when you're thinking about an improvement? So what are people thinking about?
I put my hand up. I didn't know if I should use my virtual hand or just come in. I was thinking about this last week because since I signed up, I was like, I really want to work on something, to really better our organization. And I was talking to my mom about it. And we went from the three of us, my mom, my stepdad, and me, to having this business, starting recovery coaching and training. And then we've just grown rapidly. And so working with people virtually, we've had to bring stuff in and then try to manage the processes and the systems and everything. Because our delivery is really great. People do training with us and then they stay engaged. They do more. We have a whole community now of people and it's growing, but it's growing rapidly and we have to be prepared for that growth.
Mhm.
As far as working together, family dynamics, all of that stuff. So how can we better create that foundation within the organization to continue to grow and deliver the best service we can?
Yeah. So thinking about the volume and how to manage that volume, when we think about, we'll talk about flow charts and how things flow, and maybe the process flows quite nicely. I don't know if you've ever seen the famous I Love Lucy skit where she's working on the assembly line making chocolates. Some people in process improvement use that video. I mean, it's an old show, and many of you maybe never have seen that show. But the chocolate factory starts cranking at really high pace, and she has to start eating the chocolate because she can't process that effectively on the assembly line, and it's this big funny mess. So for you, in terms of Khalees, your volume, and oh, by the way, I did see that you raised your hand, but it's so funny because the little hand showed up right in your window, which is really bright, so it looked like a tree or something. I couldn't even see it out there. But anyway, so the idea of thinking about how you're managing the current volume, but then if we double that or triple that, we have a process that's been built around current volume. It's built to do that, right? We can probably assume that it's not set up to do times 3, right? So it's not failure when things start to get a little challenging. It's that you built it for its initial volume with those expectations, and now it's growing faster than you thought it might or than expected. So now we do have to go back and not assume that this structure works for that volume. So when we talk about using these tools, that may be the spot where you look at the flow chart and say, with bigger volume, you can think about it as a literal river, right? When things are flowing through the river, where do things get jammed up? If there's too many of them trying to flow through that particular narrow spot. There are certain spots for you where you will see things getting jammed up because the volume gets stuck there. And it might be when people first give you a call and you have to respond to them. It might be when you're setting up certain appointments and now all of a sudden you're having to push those out too far, and then people have to wait too long, and then they get frustrated, and then maybe they don't continue with you. You lose them as a participant with you. So watching the flow chart for you, I think, will be important to think about how that tool can help you to sort that out. So that's good. I appreciate you sharing that. Does anyone else have anything that they'd like to share in terms of what you're thinking about?
Go ahead, Jana.
I've got a question, but I can't find my little reaction thing. All right. So I'm just going to raise my hand in an old-fashioned way. So I'm so sorry I wasn't able to be here last session, but something came up unexpectedly at the last minute. I do want to be able to access that recording though. So we can talk about that some point about how to do that. But I did think about a process. So we have just hired in January our first recovery navigators. Okay, peer specialists. And we're a treatment agency, been around 50 years. We're really excited about providing this service to our clients and to potential clients in the community, or even just anyone in the community. We're not necessarily asking people to become a client in order to get this service. Mm-hmm. But where I'm struggling is we have provided training, we've provided forms, we have explained this to the clinicians, and yet somehow there's a disconnect. Somehow we're not getting the referrals to the recovery navigators that we know are needed, and we know could be of benefit to the clients. So we're just literally we're just choosing them ourselves at this point. But there's something wrong. There was something wrong in that process. We did, I'm going to take responsibility for that. There's something that led the clinicians to not make that referral. And I'd like to figure out where that is and then how we can improve that, so that they're recognizing when a recovery navigator could be helpful to the client.
Yeah.
Does that make sense?
It does. It makes a lot of sense. Yeah, absolutely.
The kind of question that you wanted?
Absolutely. And that's a really clear process focus. Because we could just say, hey, everybody, don't forget to make the referrals. And you could say that once a week for 6 months, and it might not change a darn thing, because there's something about the process that's not working properly. And is it about people's assumptions about when and how they're supposed to do it, about who's appropriate? Is it an information thing? Is it a sort of a teamwork thing? Is it a confidence trust thing? There's something going on here with this process that's inhibiting it, that's getting in the way. So it's perfect. So it also makes me think of another tool that we'll be talking about, nominal group technique brainstorming. And that's a really good question. If everyone is in agreement that the referrals are not happening and people want them to happen, so to have and we'll get to that tool later on in the process when talking, for you to think about brainstorming with your team to say, what can we do to increase the volume of those referrals, and just gather up a whole bunch of ideas for consideration. And it's probably that there's some process flaw. There's also the possibility that you have a variation in belief or practice. Some folks might be more motivated to make them than others. Some folks might not want to be making the referrals for some reason, and maybe they're not comfortable saying why it is that they're not wanting to make those referrals, or they may have a limited understanding of why they should make those referrals, or what the service would be when they make the referral, right? Do they even understand what's going to happen, right?
Every one of those questions you just stated has come to our mind.
Yeah.
And yet we're not the ones with the answers to that. And so, somehow we've got to get back to the clinicians about why not, because they were all jazzed up about this. They wanted it, they got it, they understood why. So anyway, but
there's always an interesting thing when we add something to a standard process and don't create any sort of process trigger to make it happen. If we just say, hey, everybody, don't forget to, and then just give them the same standard process that they've been working in, even if they're all in love with whatever it is we want them to do, it doesn't take long before they forget to do it, because there's no way that it's built in that they can't, there's no way for them to, there's no requirement that they, in order to get from A to B to C to D, they have to consider that, because it's, it's not built into a sequence or to a checklist or to some automated process, which requires, in order to admit someone, you have to check the box as to whether or not you're referring for peer recovery support or whatever it might be. So a process that requires the question or the analysis or the review, right? So that's, again, back to some of that flowchart stuff where we think about the sequence as we maybe walk through, and we'll talk about walkthrough today, as we think about what it's like to go through that experience. And we could walk through this from the perspective of the clinician as when they would be making the referral, what's to trigger them to think about it? What's there to indicate that they should be doing some analysis of this question? What pushes them to do that? Or how do we make sure it happens? So that might be a way to think about it. Great, good examples. How about one more person? Is there anyone else who has an idea, something that you're thinking about that you would like to improve that you could share with us? Does anybody else have one? I would encourage you to take the advice that you heard when we were talking about our this idea is that it's easier and better to learn these concepts when you have something in mind, so that you can frame these ideas around a particular agenda that you have, a particular project or concern that you have. That makes them come to life, and then they're not just abstract concepts, right? There's something that you're applying and using in relation to that. So even if it's not something you're sure that you are going to do, try to think of some idea. I see Ken wants to share something with us.
I think that my opportunity is so large, I'm afraid to like put it out there. So we've just received a grant to provide more services to our county. So currently we're kind of focused on a small portion of our county, which is a very homogeneous community, and now we're going to have to deliver services to a very diverse community. And and part of the grant is cultural competency at all levels of delivery and hiring, and so it's a cultural change in our institution, as well as community needs assessment, getting input from the community to find out exactly what they need, how we can deliver that. It's just a very big it's a big project, and we're confident we can get it done. It's just part of it's still we're still in the kind of the brainstorming stage and the early opportunity stage. So
yeah, we actually do this material. We offer the Change Leader Academy in relation to several key topics, and one of them is cultural and linguistic competency. We've done it several times where we look at the class standards and think about projects that people can do to increase equity and inclusion and cultural competency within their system. So that might be something you might want to think about, either attending it when we do it again, and or as we're learning it here, to be thinking about it through sort of a dual lens, kind of the peer support, peer services lens, and also the culture lens, the diversity, equity, and inclusion lens. Are there things that we could change? And I think the parallels are, really strong, as using those two lenses. They kind of come together, they overlap quite nicely, I think. So that may be a way of thinking about it. I don't know. Does anyone else have any thought about that? Chris looked like she liked the idea. So yeah, it's good. I thought I saw another hand, but maybe I didn't. I think maybe we're good. Okay. All right. Well, thank you all for sharing those. Those are really helpful ideas. So again, everybody be thinking about what it is that you want to do, what it is that you think is important to you as a potential change, as a way of framing these concepts around something real for you. So with that, we'll proceed. We want to talk about some of these key questions for working on designing a change project. So thinking about that area of concern or improvement, something that you have a goal to try to work on. And then we're going to work our way through these different tools. So we think about what it's like to be your customer. And in order to do that, we'll talk about the walkthrough and flow charting today. These are a couple of our standard tools that are really helpful to better understand what it's like to have the experience of receiving the supports that you provide. Then we'll think about what it is that you're trying to accomplish. We'll come up with an aim. We'd like to create a certain improvement, and let's kind of refine that into a particular aim. Then we'll think about knowing if a change is an improvement. We'll come up with a particular change that we can make. That's where I mentioned the nominal group technique, where you can brainstorm for ideas to come up with a change project. And then we do PDSA, plan, do, study, act, rapid cycle testing of that for that project. And so we'll tell you how to do that, teach you how to do that. And then this question 4, what changes can we test that may result in an improvement? We'll talk about measuring, because we always attach measures, of course, to any of these change projects. We want to have a baseline. How are we doing now? And then we'll do a change project. And then how are we doing after? And then final question, how can we sustain the improvements? We always like to talk about sustainability. We were just sharing that idea of implementing something new, like Jana was talking about implementing those referrals. And even though everyone's motivated to make a change, as we know, they're hard to sustain, no matter what it is. Anything new, it takes time for it to be built into your system, and you have to make some pretty concerted efforts to make sure that it becomes your standard practice. And so how do we standardize that? How do we make sure we sustain the things that work for us? Obviously, if something doesn't work for us, we'll talk more about that when we discuss PDSA. If it doesn't work, then we don't continue it. It's an experiment. And if it does work, we want to try to sustain it. So toward the end of our time together, we'll talk about sustaining things. I want to point you toward the change project form, which is part of the tools that we have shared with you and that you can also access through our TTC network. We'll be using this format as a model. I always encourage people to kind of check it out and use it as you try to structure a change project. Then we'll talk about the first parts of it today in terms of some of the tools that you can use. And this is just a simple form that's a really helpful outline for structuring a change project. Some folks don't like to use the form because they just sort of feel like they want to do it independently and feel comfortable doing it without using the form. I always encourage everyone to use the form because it's a really simple way to make sure that you look at all of the key questions that you need to answer as you're deciding what your project is and how you're going to implement it. So, and thanks, Chris, for sharing a link to our handouts, which include this form. So you can see that in the chat where we have the change form. So thanks for that. So I first want to talk a little bit about this designing of a change project. We start by trying to come up with an aim statement. And we want for our whatever goal we're trying to achieve to be a SMART goal. You've seen this acronym, many of you. The SMART goals should be something that's very specific, something that's measurable. So if we're saying we want to, back to Jana's idea, we want to increase the number of referrals that are successfully completed. That's really not that specific, right? We might say, well, we want a specific measured number of them. We want to improve it from X to Y, and I'll talk about that in a little bit when we talk about the aim statement. It should be something that's attainable, reasonable, realistic, that we could actually do. Should be relevant to our clients, our customers, our recipients, our service peers with whom we're working. It should be relevant to them and to our mission and our vision of what we're trying to do to support people. And time bound. If we just say, let's improve this as soon as we can, that's kind of vague in general, right? We want to say, let's improve this by date X, right? We're going to give ourselves 3 months to work on this. We want to put a little bit of constructive pressure on the process. I say constructive. We don't want to stress everybody out, right? We want it to be reasonable, back to the attainable, right? But we want it to be a little bit of a push, right? Let's make a priority out of this and let's see what we can do and let's put a time limit on it. So most good planning involves time limits because it helps us to stay focused and to prioritize. So that's the SMART. I know some people are turning SMART into SMARTY, and we had this conversation with some of our work that we've been doing, where SMART becomes SMARTY when you add inclusion and equity. So DEI, equity and inclusion elements to the SMART. So make sure that it's equitable and it's inclusive as you're coming up with your goal, which I think is a helpful additional element, 2 elements to consider. Because sometimes we might come up with a goal, and if we added the equity and inclusion elements, we could say, our goals kind of only works for some of the people we're serving, but it doesn't work for this other subpopulation. They're kind of left out of our goal. is that okay or not, right? Is it sort of specialized? And is it okay for us to not have it be focused on certain folks, or is that a problem? So good to ask those questions as well when you're coming up with goals. So aim statements. Our aim statement is a simple equation, and here it is. Increase A from B to C by date D. So there's a good bit in that simple equation. We have to figure out what it is that we're trying to improve, and we want to increase it from A to B. We see we had a little bit of a glitch here with our language. Increase A. Yeah, well, it's okay the way we have it. For A, whatever it is, A from B to C, excuse me. And so B to C means that we have to have a baseline, right? B is for baseline. Baseline is our current state. How are we doing with our current measurement? How many people are we serving? How many intakes are we doing? How many referrals are being made? How many folks are having a certain experience with us that we want to try to increase? We have a baseline number and we want to increase it to see whatever that is. And we put a date on it, just like we were saying before with our SMART goals. So figure out what we're trying to do, measure how we're doing now, figure out how much we think we can increase it, and put a time frame on that. So some people start asking questions like, well, how much should we try to do? From B to C, how do we figure out what we should have as a goal for ourselves? So we like to use this simple idea related to goals. It's good to talk with your leadership team about that. And it's good to set what we would call a stretch goal. And we use this simple question. Find a level of improvement that you think about half of your team thinks will be achievable, and the other half of your team thinks will not be achievable. So if one person says, well, I think we can double that, that's definitely something we can do. And someone else says, no, that's way too high. I think we can only increase it by like 20 or 30%. And then someone else says, I think maybe 50%. So people will have different ideas, right, about how much of an improvement you can make. So find something that's in the middle where about half your team thinks you can do it and the other half thinks, oh no, that's too hard to achieve. So that's sort of the stretch goal territory. Any question about that? Does that make sense as an idea? The point here is we don't want a goal that's demoralizing because it's just so extreme. Like, we're going to increase this by 1,000%. Who's with me? I said, well, that's never going to happen. That's kind of a ridiculous goal. So that's not going to energize anyone. It's going to seem silly to people, or it's going to seem overwhelming, and that's stressful. So that's too much. On the other hand, let's increase it by 3%. Who's with me? Well, that's barely even noticeable, and that really won't feel like much of a change to the people we're supporting. So, and everybody thinks that's easy to do. We could do that without even, that could be just sort of accidental, improvement without even trying anything new. So finding that stretch goal in the middle. Any questions about that, or that whole idea of like what we should set, how we should set a goal? You probably have had experiences in trying to think about this stuff before, when you're trying to think about what's reasonable, what is a reasonable expectation for the support that we're doing, and how much of something can we do, or how much can we improve it. There's also the idea of benchmarks. So you might have some standards that you can get from some other services. If you're trying to figure out what is a reasonable expectation for yourselves, you might look to some other services or supports that you are aware of that might be a role model or a standard for you. So that's always helpful too. And that's often the benefit of communicating with others, folks who are doing similar work, providing similar supports, talking to them about how they do it, or hearing about what the standard is or what the expectations are in different environments can help you to come up with those standards. Although there aren't a lot of those for certain kinds of services, particularly services that are relatively new. And I think we could say peer supports are relatively new compared. They've been around for a while, but compared to other kinds of supports, they don't have as much history, so they might not have as many benchmarks out there in terms of, standard peer support of program X usually does Y units of service per, there's not so much of that stuff around like there might be, for example, for outpatient clinic services, because those have been around for a long time and there's a lot of sort of data and standards around that. So it's a little easier to come up with benchmarks for things that have had more volume for a longer time. There's so many of those services out there. So, but there are some. Yeah, go ahead, Chris.
Yeah, so this is an area, a couple things to keep in mind is, and things I've looked to are, the community health worker field has done, I feel like, a lot more work in creating those benchmarks, and the work is really parallel to peer support. And so if you look to maybe a like-minded organization or size-wise, that sort of thing, that might be a good guide for you as far as making that aim. Because again, community health workers and peers that are integrated into systems, they don't do the same work, but they do similar work. And so I feel like the community health worker field in general has gotten more help from our public health agencies. So there's some, even if you just kind of Google like outcomes for community health workers or that sort of thing, you're going to find a lot of toolkits and things produced by local health departments. And so that's some really good information. And then when you're going through this process, be sure that the peers who are in the programs are at the table when you're making these decisions, because they're probably going to have a lot of good ideas about what this might look like. And if you're more advantageous, work with your service participants, with the people receiving services when you're making an aim. Chances are they're going to be really concrete, really realistic, at making an aim that could improve services. And they probably won't be, wildly out of place or anything. They're going to be pretty concrete and realistic. And so don't be afraid to ask the people most impacted, which are the people you're providing services to be at the table, and their family members when making an aim.
Yeah, those are really important. I find that people who are receiving services, whatever kind of services they are, usually have pretty realistic expectations. Most people receiving a service don't get terribly grumpy over stuff that's unrealistic. They usually get grumpy over stuff that's realistic. Most people don't go into a store and say, "Hey, I've worn these clothes for 6 weeks and I've shredded them and I'd like my money back." I mean, that's not a common thing. People don't do that. We have realistic expectations about what services are deserved or are manageable or can work or available, should be available. So I really appreciate Chris's comments about that kind of inclusion, to make sure we have people at the table to share. These all should be team activities. These should be inclusive, integrated, diverse teams of people thinking together about everything that we're exploring here, right? One person can do this stuff, but it's never as good as when you have multiple people with different experiences at the table talking about it together. So that's a really important reminder for us. Okay, so maybe think about it for a second. Just kind of ask yourself that question. Maybe take a minute to think about, and maybe just in your head or on a piece of paper right now, just write down that aim statement idea. I'd like to increase A from B to C. Now, I don't really know what the B is right now because I haven't figured out my baseline, but you could just, kind of guess. I'd like to increase the number of referrals for this service from, maybe we're doing 2 or 3 a week. I'd like to see that be 6 or 7 a week. And maybe we could do that as a team by, maybe by July, we could increase that. So just think about something that you might like to do and try to start using this simple equation for thinking about improvements that you could make. It's a much more useful strategy to use this simple equation rather than to say, hey, we got to get better at X. Could everybody try to get better at X? I mean, that's a reasonable thing to say, but it's so vague and fuzzy, it's not likely to kind of create real behavior change, right? So, but this gets us starting to focus, right? Now we're starting to measure something. So I'd encourage you to try to use this model. So again, we come up with a change project, and we want this to be in alignment with what your mission is, what your goals are. So this idea of the why statement, or the mission or a vision statement, we do X so that Y, you see, are next to that foundation of this pyramid, right? So if we have a service that is the X, right? We provide these services, these supports, because we're trying to have a certain influence in the world. We're trying to support recovery. We're trying to help people to achieve their goals. We're trying to all the different things that might be a part of your mission related to the supports that you provide. So we want to make sure that whatever change project that we come up with is well aligned with those things. I think that seems intuitive and makes sense to most. It needs to be consistent with who we are, how we view our role as part of our community, as part of our recovery community and our broader community. What do we want to try to promote in this world? So whatever it is that we pick as a project should be lined up with that. Okay, so now we're going to talk about this thing called the walkthrough. So this is the focus of the walkthrough exercise, is thinking about what it's like to be a customer of a certain process. So I have a couple of signs that are kind of fun to look at. Like, what does that mean? Or how about this one? Or how about that one? This fourth one is someone who got mad and left their message and catch up. I don't recommend that when you get mad. But bad service, bad customer service, when you look at signs like this, these are signs that made sense to somebody who put them up, right? But they don't make sense to us because we don't have enough information. So if we did a walkthrough and pretended to be the customer of this sign, right? If we were trying to go to some place and this sign was there, we would realize, oh, that's terribly inadequate. It doesn't get the job done. And I didn't realize that, but I know what the difference is between entrance and not entering. And I know what garbage is and what trash is and how those are different, but the customer doesn't. And so this is not adequate. I need to improve this so that they can have a better experience. So what I want to do is share a video with you. And I just happen to need to flip to another slide deck for 1 minute. Let me just pull that up because there's a video that I want to share with you that's on a different spot. So hang on 1 second, I'll pull that up for you. Okay, so this is a video of a comedian, Brian Reagan. You might have heard of him or seen him before. He's pretty popular. And this is a video of his experience. It's called The Emergency Room. And so this is a good example of what a walkthrough is like. He's sort of doing a walkthrough of what it's like to go to the emergency room. So I'm going to play this video for you, and then we can chat a little bit more about this whole walkthrough idea.
I'm feeling good. I actually just recently had to go to the emergency room, though, and I had some stomach virus thing. I almost called an ambulance. It's weird, even considering calling an ambulance for yourself. You know, you call ambulances for other people, right? What are you supposed to say about yourself? Can you come get me? Yeah, I don't feel so good. Just come on in, I'll be lying on the floor. Just looking at the phone going, I don't know how to do this. I don't know what to do. It was at night, so I drove myself to the emergency room. That's a nice relaxing drive. No, after you. Merge, everybody, merge. I'm only imploding. So I pull up at the entrance to the emergency room. No valet parking. I mean, if that's not the biggest oversight in our solar system. If there's ever a time where you want to go, can you park this because I need to collapse immediately? But no, I'm circling around a parking lot. Can I park there? I think I'm going to die. I'm dying too. Okay, go ahead. Yeah, I'll go up a couple levels. Unbelievable. I don't care if you're driving yourself or someone else to the emergency room. You still want to get out and run in with them. Are you supposed to drop somebody off and go park a car? Okay, you go in. Tell them you're shot. Ask them if they validate. Unbelievable.
All right. So you get the idea, right? So if you, it's of course a silly, fun video, but you hear him talking his way through a sequence, right? A process, because this is all about process. So he talks about, the getting sick part and the calling part and the what's it like to call, what's it like to drive, the drive part, the whole parking part. Has anyone had any experiences related to that reminds you of when you think about experiencing any kind of care system or support system or service system where it just like, why is it like this? Does anyone have an example that they might think of? This is pretty funny, but a lot of us have had tremendous stress and frustration with exactly that stuff that he's talking about. Would anyone share something that you're thinking of that you've encountered?
I'll share something really quick. The other day, just because this just happened, I need to take my son to the doctor. And so I was trying to call to get an appointment because they say call. I literally called 120 times and they would not answer. 120 times.
Yeah.
Take my son to the doctor. And then I went and I just got to the point where I said, I'm going to walk down there. I walked in and the receptionist was just hanging out. The whole office is empty and everything. And I'm like, my son is sick. I was just frustrated. Like, what is going on here? You're sitting here. You can't answer the phone. And I called 120 times to try to get through. It just drives me insane.
Yeah, that's terribly frustrating. You remind me of an experience I had recently when I was at the pharmacy, and this woman just started, I didn't know there was anything going on, but she just started yelling, screaming at the pharmacist or the tech behind the counter. And of course, everyone's first reaction is, what's wrong with this woman? Why is she like this? What's happening here? We all kind of got a little nervous, and it was real. But then as I listened, it became apparent that she was just not getting the service that she needed. And somebody at home was really sick, and she was just so stressed out because, they didn't have the medication. They were supposed to have it. They didn't have it. And she was really upset by that. And so, it was just one of those moments where she was just in really rough shape, but she was clearly not receiving good support or care from the system. And it was terribly stressful to her. Okay, so Chris wanted to share something, and then also Ken. So what about you, Chris?
Oh, I was just going to share that, it's really frustrating when you're expected to be at your doctor's appointment, 5 to 10 minutes before,
right.
And then you wait
right.
40 minutes to, but if you cancel within 24 hours, you're
right.
fine.
Yeah.
And that is so frustrating, especially with children. And I'm not always able to get childcare. So I've got to haul 3 children and keep them busy in a waiting room for 45 minutes and then get put in another room to sit for an additional 15 to 20 minutes. Like, it's really frustrating.
Yeah, for sure.
And it just feels like they overschedule.
Yeah.
Um,
And those are all flawed processes. The whole business of, well, we're sorry, we're running an hour late. And I want to say, well, you're seeing all of the people that you're going to see, right? Do you guys stay an hour late every day? No. So basically, you just do the whole day an hour late. Well, how does that happen? There's something on the front end where you just get late, because after you get an hour late, you stay an hour late. So you're pretty much on time after that, just an hour after. So the front end of this day is somehow getting really messed up, right? So there's some part of the process that needs to be adjusted. That system is not adjusting it. So they get a little bit later, and then get to the hour point, and then they start working differently, because they're not going to get 3 hours late, because that's totally wrecks everything. Then they stay an hour late all afternoon. So that means that the afternoon is done pretty efficiently and on time, so to speak. The morning is not. So they're operating differently in the AM and the PM, but they don't know that that's what they're doing, because they're not analyzing their process, right? So Ken wanted to share something.
I'd say literally most every customer service contact now is, you have to jump through a million hoops to try. We're the consumer, and I've got to make all this extra effort. First to try and find a phone number. Many of them don't even list the phone number anymore. So now they're asking you to go through, some kind of automated chat system that doesn't answer questions directly that you want answers to. But the breakdown in the process, I believe, is on our end as consumers, because we've allowed them to do that, and we continue to buy their products and give them money, and they just continue to keep giving us worse and worse customer service.
Yeah. So where is the voice of the customer in the process? And that's what we're trying to do with the walkthrough, is to understand the voice, right? To give voice to that experience by doing what we call a walkthrough process. So I appreciate those comments. Very helpful. Thank you for sharing those. Did we have anything else? I thought maybe I saw something else. Maybe not. Okay. So let's talk about what we mean by this whole walkthrough idea. So a walkthrough is basically a role play of an experience to try to understand what it's like from the perspective of that customer. And it relates back to that number one NIATx principle that we talked about last time, understanding and involving the customer. So what we want to do is to see and feel and experience the process from the perspective of that customer, right? What's it like for them? To find out what works, to find out what doesn't work, kind of look for the challenges and issues in the process. We want to involve stakeholders in the process so that they can be sharing their improvement ideas. So we want to have somebody actually go through the nuts and bolts of this experience to see what we can learn from doing it. Sometimes you might not feel like you can actually do a physical walkthrough and role play and see what it's like to be the customer. You might do what we call a talk through, which is to kind of talk through the process, but it's definitely preferable to do the walkthrough, because when you actually do a role play process, you have all the feelings associated with it. And that's pretty important to understanding what it's like to have the experience. Some of you may be familiar with things like a secret shopper idea, where you pretend to be a customer, and sometimes different organizations, businesses will do this, where they'll try to receive their own supports as a secret shopper, and then that's how they can kind of monitor quality. I'm not recommending secret shopper here, because we don't want to sneak up on people and have the gotcha moment, like, aha, caught you screwing things up or messing it up or not doing it right. That's not really good for team morale, right? It's not good for cohesion and trust. And also, we're not trying to evaluate the performance of a worker. We're trying to evaluate the process. So I like for people to be doing their best job. Some people say, well, if you don't do secret shopper and sneak up on them, then they'll just be operating on their best behavior. And I say, that's what I want. I want their best behavior, because in that doctor's office we were talking about, on their best behavior, they're an hour late every day for the whole afternoon. That's their best, what they view as their best standard practice. That's not because someone screwed up on Tuesday and caused everyone to be an hour late. Everyone's doing their job, and it's still an hour late every day. So there's something wrong with the process. And that's what we want to keep an eye on. That's what we want to look at. So the idea is we just select somebody to try to have this walkthrough experience and see if we can really understand what it's like to be the customer. Has anyone ever done a walkthrough? Let me see if we've had anybody here as a part of our group who has done something like this, where they've done a role play to try to find out what it's like to have the experience of someone. Has anyone done this? If you have and you'd be willing to say a little something about it, that'd be great.
We had a couple hands up. Khalees.
Oh, I was just gonna say, like, I guess we've done this a couple times within our organization because we deliver training, and then kind of and since we started from the beginning, we wanted to make it easy and accessible, and we have a lot of conversations with people. So we made it so we started to get a bunch of questions, and I kind of walked through the process as if I was somebody curious about training. So I went through and I did a whole audit on our website. And I was like, okay, well, how much is it? Is the price visible? Are all my questions being answered? Kind of going through this. And then I registered for something to see what is the response, like the email response, or, you know, just following that process as well. But then I also went through the process as if I wanted to speak to somebody. You know, are we responding quickly? So we have Facebook Messenger, people message us on WhatsApp, people call our phone, people email, and we even make it easily accessible now for people to book a 30-minute Zoom with us. So then if people miss that Zoom, like, we have a process of following up with them and saying, hey, you missed the Zoom. You know, we just want to make sure you're okay. If there's any way we can help. And that's been like a really amazing turnout, because people are like, oh my God, I completely forgot. Thank you so much for reaching out to me. You know, and then if it's a financial barrier, how can we support you with that? And so I've kind of walked through that process. I think we have really good processes from the customer perspective. I think it's internal management, you know, as far as the internal management and processes that we still got to get clear on. We still have some things to tidy up internally, but from externally, it's good so far. I mean, so far, I'm sure we can always improve, you know what I'm saying?
Well, I mean, starting to think about targeting in certain areas is important, because we can all improve everything. Nothing's perfect, but to prioritize, which is what you're doing. Where are the spots where we see the most room for quick growth? Where are these low-hanging fruit, so to speak, the things that we can do easily and quickly that will have a big impact and make a pretty significant change? And starting to think that way as you're doing is really valuable. Thanks for sharing that. It looks like Juan wanted to share something related to this question of the walkthrough.
Yes, we've been doing that once a year. We include in our participants, we call client participants. And in getting them involved, we let them know where we are as an agency, what we're doing. And then we go through what is working, what is not working, what they should think that we should be doing some more in some areas, you know, where we can improve. And then we get, as a staff, we get all of that together, and we get together and start looking the solution where we're going to be making some changes. And then when we do it again, we bring in back the, you know, what decision was made. So we get back to them that we've been listening to them, we hear them, and this is what we're going to do different now. You know, and it's amazing how we found out, you know, where we've been going real high in one area, and how I don't want to say we neglect, but we let it, you know, less. And with that, we create a suggestion box where people can suggest stuff in there, and we go to that quarterly, you know, because they feel part of something. When you call it them, they have the input, not like, you know, it's what we say. So we get them involved, and we let them know their opinion matters to us. With that.
Yeah. Those are really important comments, Juan. Thanks for sharing them. We we've all had the experience of providing a suggestion to someone or some system where they say, okay, thanks for your suggestion. And we can just kind of tell like, oh, they're not going to change anything. They're just brushing me off. Whereas other times we can do what Juan just said, which is we heard you and here's what you said to us. And we heard that. And so here's what we're changing. And that really is powerful feedback to the customer. It really gives them a strong sense of their voice. And I also really like what you're saying about repeating the process, because you can plan to do walkthroughs periodically. It's not a one and done situation. You walk through something and learn something important and work on some changes, and then walk through it again. Periodically, to just keep looking at it and maybe have different people do the role play to have the experience as the customer, and each person will have a different set of eyes. Sometimes it's really helpful to have new people who are new to the system do walkthroughs, because they don't have any assumptions about how it's supposed to look or what is the proper way to do it, or they're not dedicated or wedded to certain practices that you already have. Some people who've been in a system a lot will do a walkthrough and say, well, I didn't really like this, but there's no other way to do it, so I guess we'll just have to let that be what it is. Well, wait a minute. Just because we've been doing it that way for 10 years doesn't mean we can't think about options or ways of changing. So fresh eyes and the walkthrough can be really helpful. Ken, what did you want to share?
I just want to share back to the secret shopper thing. Anyone that's worked in an environment with a secret shopper, I know I did, and you tend to find out what the requirements are of the secret shopper, and then you kind of search for the secret shopper, and you it's like teaching to the test. Like you just all you do is you're trying to get the highest score on the secret shop, because it's a metric that's measured. And instead of maybe taking better care of the customer, you're more worried about getting a 90 or 100 on your secret shopper.
That's a really good point.
They're not so secret. You can figure out who they.
You can find the spies. Yeah, that's a really good point, because then you're not even thinking about the customers. You're just thinking about jumping through the hoops of this exercise. So it really doesn't improve the customer experience or get you to think about how to enhance the service. It becomes this other kind of a game. I agree completely. I think your point is a really good one. So yeah, it doesn't do what it's designed to do. Having a more transparent process will get everybody together saying, we're a team, let's look at this, let's figure out how to make it better. Secret shopper is not team at all. It's the assumption is that the person being evaluated doesn't really care about this, and so we have to get them to do different behavior because that's the only way to create change, which is a terrible assumption if you're trying to build up a team and want to have people who are dedicated to a mission, right? So yeah, thanks for that. I agree completely.
Well, Matt, when we use this process at a intensive outpatient facility where I live, in specifically for integrating peers, we actually had 4 different people complete a walkthrough from the organization. It's because each person had a different perspective. So like intake, administrative support, a clinician, and the peer all did walkthroughs, because it was very different what people thought of as like a timely response or a person-centered response, or how you felt about the information you were given. And even in doing that, they found areas for improvement beyond our focus area as well. So it was pretty cool. And I think it is helpful to have multiple people walk through that process. And again, not as a secret shopper, but just different perspectives.
Yeah, I agree. And it also brings up issues like privilege, where if you have people with different experiences doing a walkthrough, you really you'll see what their assumptions are. Like, I can't believe that I was treated so terribly. What's going on? So, well, yeah, I walk through the world and people treat me nicely, huh? What do you know? Maybe because I have a certain credential or a certain look, or my joke is as a white man, an able-bodied white man in and out of stores of a certain age, I feel I could like steal anything I want. No one cares. It's like they just assume that I belong wherever I am, and no one's ever following me, and no one's ever causing me any. There's no one's ever looking at me. All these privileges that I encounter. So when I do a walkthrough, it's like, hey, wait a minute, I'm used to a certain kind of customer service. I'm frustrated that I'm not getting it. Then folks who are used to poor customer service sometimes come with this really humble response. Well, I guess this wasn't so good, but I guess they can't do any better than that. So comparing their experiences is really powerful. Like, why did this person get so frustrated about it and that person not? Well, maybe people are used to different things, and how do we feel about that? And how do we want to make our customer service process fair and equitable for all parties who might encounter it? So I love having different lenses on that, because it reveals some of that stuff, and that's really important to do. Thanks, Chris. All right, so these are all great examples of walkthroughs. So I'm going to move on to some other territory, which is to talk a little bit about the roles. So we do this walkthrough, we kind of get a sense of what's going on, and we'll talk about some of the other tools related to that. But I want to take a little time to talk about the roles in this NIATx model, because we have several roles that are important to our projects. One is the executive sponsor. We talked about one of the principles, which is fixing problems that keep the CEO awake at night, right? So it's really important for us to have executive support for anything that we're trying to improve. So we call that the executive sponsor. So this might not be someone who's actively involved in your change project, but it is someone who has administrative power to help you to get the resources, the time, the people you need to work on your project. In small organizations, these roles might be filled by the same party, or the same group of people might do all the roles. But in larger organizations, you might have a senior manager who's giving you support for your project and helping you to do your change project. They might not necessarily be part of your active change team who is implementing the change that you're doing, but you might need them for certain kinds of support. So it's important to make sure that they're aware and that they're informed and that they are supportive, because that will help you to make sure you have what you need to do your project. And that might be some time, for example, at the end of a meeting, or that might be some resources that are important, or they might need to encourage someone to participate who's important to what you're trying to do. So that's key, to have that leadership help when you're doing this. Then we also have this change leader role, which is the person who we designate as the leader of the change project. So we want someone who has some leadership skills, who has some influence in the system. They don't have to have formal power, like be a supervisor of people. Sometimes they are. Most importantly, they have to be someone who can connect with others, can have influence, and can facilitate a process, and has some energy and time to do that. So the change leader is the person who will actually be running this project, sort of facilitating a team, and helping to manage and organize the change project that you're deciding to do. So once we figure out what we're trying to do, what our aim might be, once we've done a walkthrough and used some of these other tools that we'll be talking about, well then the change leader will kind of organize that team and move the project forward. And then we like to see some other people involved in the process. We want to have a team of several people. So we say 3 to 7. I think some systems have more people, some have fewer people, but it's important that there be several people involved. Very small systems that maybe just have 2 or 3 people working in the service, then it might be, your team is your whole group, right? So we would want to have several people part of the process of trying to implement the change, working together, using these tools that we're talking about to try to figure out how to make the improvement. So any questions about those different roles as I talk about them? So senior management, executive sponsor, then a change leader, and then these members of a team that are going to work on this project together. Any thoughts about that? Okay.
I did want to mention here too, Matt, I think this is an important, Matt and I talk about this pretty exhaustively, but I think this is a really important, pivotal moment that you could have the peer on your staff be the change leader, because it gives them some authority. So largely when a peer enters into this larger kind of, especially like clinical systems, they're typically kind of at the bottom of the totem pole, and people might even not be familiar with like they know what a peer is, but they don't know exactly what it is they do every day. And so as the executive sponsor or someone with decision-making authority in your organization, by empowering that peer to lead a change process and have a team of individuals, staff members that I wouldn't say they're in charge of, but they're leading the project, gives them some authority in a way that helps people see that these peers are here to like further connect our system, to help clinicians practice at the top of their license, to provide really a continuity of care within that clinical system that your participants are in, like kind of sees all the good stuff that peers bring. And that process can take a year or more when you're implementing peer support, if your system is total kind of novice, or the system may just see that peer as a add-on. So kind of keep them on the peripheral, like, oh, that's nice that peer is here. But when we really read the literature and study about the purpose of embedding peer support, it's to transform a system. It's to bring a recovery orientation to that system. It's to amplify the voices of the people you serve, to bring the voices of the people you serve to the table where decisions are being made. And so even just that really super minor thing of putting the peer in charge of a change project can help with that and gives them, like I said, kind of that authority, and they can own their position a little bit more too. It's really intimidating if you haven't had that experience coming into a system with people who have, 4-year college degrees in clinical training, to come in as a peer and you're really using your lived experience, and that's not always valued in those systems. And so it's an easy way to kind of, assign that, like I said, just assign that peer with a task that helps other people see them as a leader.
Yeah, I think that's a really good guidance, and it's a way to make we can talk the talk all we want to, right? And but it's walking the walk of saying, yeah, you're responsible, you're in charge, this is your project, and people will see you as the lead on this, which changes the dynamics of those relationships in a pretty dramatic way. So yeah, I strongly encourage that idea. Good stuff. Jana, did you want to say something?
Yeah, so I will tell you something that I felt was very successful in this first, we've just finished the first 90 days of this change in this project. And that is I did not have any recovery navigators who were going to manage this project. It's just that they weren't at all prepared for that. We didn't know enough to start to have to help them. But what I did do, and what we have done, is we hired the recovery navigators, and then we built the program. Mm-hmm. And the recovery navigators were a part of every conversation about building the program. They were the primary people who were there. We never left a meeting that I didn't hear from every one of them, and I also gave them responsibilities for things like, what do you think the text should be on a brochure about recovery navigator service? If you were a client And they're more likely to know what it's like to be a client than I am at this point, you know. If you were a client, what words would you need to see on there to make you want to come to this service? So I think that even if someone is not prepared to be the project leader, you can really include them in the decision making in such a way that they have a lot of ownership. I mean, today, 90 days later, that's their brochure.
Mhm.
That's their process of referral. You know, they decided what was going to be on their referral form. They're the ones who sent it out to the counselors. So there's ways to do that so that your team is a real team as well.
Yeah.
I think.
Yeah, no, I agree. I think that you're talking about a process, that sequence of hiring people and then building rather than building and then hiring. Hey, everybody, we made your job up for you. Here's what you're going to be doing. Go do it. I mean, we want you to feel empowered and in control of things, but here we already set the table for you. Here's what you're going to have for lunch. Wait a minute. We took away choice here. We didn't allow folks to have choice.
We were lucky. Okay. We were lucky that we didn't have this service.
Yeah.
I mean, the next round of recovery navigators will walk into a service that's already been designed.
Mhm. So in that case, you can create a process, excuse me for interrupting, you can create a process which allows you to kind of recreate that inclusion experience, right?
Yeah.
We're not making assumptions that what we created is the perfect thing. And now we've got new eyes and ears. And what do you all think? It's time for us to reconsider.
Yeah. Yeah, that's a good point, is that we do need to think about that as we hire the second round, which we're not going to do for a few more months because we just want to get this gelled a little bit. So
yeah, it's good. Thank you for sharing that. Chris, I don't know if you had any comments on anything that Jenna was saying. I want to move on to our flow chart, but we have a few minutes here. So you good?
All good. I love it. Yeah.
Okay. Yeah. Thank you all. Great comments. Very much appreciated. Okay. So let's come back to our material, and we have another tool that we want to talk about here, which is the flow chart. So if you've done a walkthrough and you've had an experience of, this part feels really good and this part feels not so good, and I think that this was a little stressful or challenging, and we kind of have conversations as we do these role plays and have people go through the experience, and peers who maybe have been a consumer of services have a certain experience that allows them to have insight, and maybe they've been a consumer of experiences within your system, and that allows them to already know some things about what they liked and what they didn't like, participating in the walkthrough, helping to explore that with you. So then what we often like to use is a flow chart. So you've had this walkthrough experience where you've had this experience, what it's like to be a consumer of this service, this support. Now let's draw a map of what we did, what we experienced. Let's draw a simple flow chart so that we can have this visual map of what occurred, and think about the transitions, the steps and the transitions. And this will allow us to start to consider how we might be able to make improvements. So this helps us to look, when we were talking at the beginning of our session, we were talking a little bit about the flow and where bottlenecks might occur, those spots where there's a pinch point, like the doctor's office example. Like everything seems to go okay to this point, and then people get stuck at that point, and that's where it backs up, right? You all probably, if you look at your process and if you do a walkthrough, people will say, yeah, it was fine at the beginning, and then they had me do this paperwork, and then I just sat there for a long time and nothing happened. Well, that's because there's a bunch of other people doing other things, and you kind of get stuck at that point. And so you're sitting around doing nothing for a while, and that's kind of stressful. So that's one of those bottlenecks where things get stuck, where people get stuck in the process. So we have roadblocks, barriers that might occur in parts of the process. We might have other challenges that are preventing the transitions between parts. If you all think about your own processes, you know that there are certain parts of the service that work really smoothly, and other parts that are vulnerable to getting stuck, where you might have a challenge or an issue. If you do this, where you map it out on a simple diagram, it really helps people to understand what the current process looks like. I say current process, and that's underlined for a reason. We want to do the flow chart based on what we've experienced in a walkthrough and or whatever else we know about our current process. We want to do the flow chart based upon what currently exists. Some people try to make a flow chart of what they want their system to look like. The point of the flow chart is to get a map of what we currently have. And then we look at that map of what we currently have, and then we start to see where the challenges are, and that leads us to the next step. To try to do a flow chart of the ideal state is usually an awkward thing that doesn't work out so well. So I would encourage you all to use the flow chart to just look at the current state. And as you do it, you'll start to notice some areas of problem. And so you might start to say, there's some steps where we have issues. So we might put a flag on those. And then we might say, well, there's some stuff that we can do to fix those spots, right? There's some things that we can do to make adjustments to those. And so that starts to lead us toward thinking about change projects. And when we get together next time, we will talk about some next steps as it relates to what you can do with what you learn by flowcharting. You can do flowcharting with Post-its and a big piece of paper or on a big board. You can, you can do them on a spreadsheet with just using cells, and or on a Word document with arrows and boxes. And sometimes we see some flowcharts that are very complicated. I'm encouraging people to just keep them very simple. It's just boxes and arrows, step 1, step 2, step 3. Sometimes you might get to a yes, no point. There's those decision points where if yes, you do this, and if no, you do that. So that might be useful and helpful to do. It's a really good exercise to do with your team, to map out what it looks like, and to try to understand where those spots are where you might be having some challenges. Jana wanted to share something. I see that she had her hand up, so I'm going to go ahead and stop for a bit and let her share.
What I really wanted to know is, what does it mean using a volunteers process? Do you mean like the sticky note thing?
Oh, so this is actually an exercise slide. So sometimes I use I'll ask a volunteer if we want to do a flow chart. One of you as the volunteer. Okay. I said, so that sort of just is a generic language. So thank you for asking that.
That's okay. All right.
Yes, don't you all know about the very famous volunteers process? No. So all right. No, I'm glad you asked. That was helpful. So Khalees had a question, and then Chris.
So I just wanted to ask, I feel like I'm trying to think about how I can use this within internal processes and communications internally, not from the outside customers' perspective, if that makes sense.
Mm-hmm. Yeah. So your internal experience as the team.
Yeah, communications and systems. Yeah, internally together.
Yeah, you can absolutely do that. Is there a sequence of steps that you're aware of in terms of how you communicate around? Is there a certain standard process, or is there a sequence that occurs with certain issues or challenges or work elements that you have to complete?
I guess kind of. It's we are a small team, like I said, and all the time, trainings, fundings going on, this pilot program over here, just all of this stuff. Just, trade order manuals. So we have a lot of different things going on. And overall, everybody we all have our jobs, job roles technically within that, but there's definitely still needs to be some smoothening, going in. So for I guess it's a communication too. I'm really kind of thinking it might be a communication thing.
It sounds like it is, and you might want to think of an example of a sequence that occurs. There's a sequence that happens when when we do this. And so there's 5 steps that occur, and everybody has to touch that. And usually it's so-and-so does this, and then so-and-so does that, and then so-and-so does this. And let's kind of map that one out. And then there's this other sequence related to this stuff. So rather than kind of thinking of it big macro, what's our big system sequence, there are these little small process sequences that occur, right? Like whenever you take a phone call and then you need to engage one of your other team members, and then they have to respond to the person because it's a phone call about something that's their territory or their stuff that they need to respond to. So you write a note to them, you give them the note, then they call the customer. And each time they call the customer, they ask them 5 of the same questions that you asked them in the first conversation. Oh, so there's kind of a flaw in our process because we're looping them back through the same stuff. We could change our internal processes so that I gather that information and actually share it with them rather than just handing off the call information. I share some content as well. Is there a way to do that that's efficient and doesn't take up too much time? So now all of a sudden we're thinking about this flow chart and how we can make it smoother and more efficient because we see a redundancy, and we do that all the time over and over, and we notice that as a pattern. So that's a small, simple little process, right, that we could adjust. Hopefully that's helpful.
I think too, like because we have, I mean, I write SOPs all the time. We have tons of SOPs because we have so many systems and processes within our organization. But it is, I think, that like communication thing and niggling things out. So, you know, if I need a face on the website, and other people have 100 jobs, then it's kind of like, when can get this get done in time management and things like that as well. So managing all of that. I'm going to have to ponder this.
Yeah, no, that's good. And standard operating procedures, what's the altitude of the standard operating procedure? Is it granular and detailed? Some of them are sort of at a slightly higher altitude, like we will do X, Y, and Z. Well, there's several steps to the X, and X has like 6 or 7 different little pieces to it. Not necessarily saying that you have to have an incredibly detailed procedures. Your policy and procedure manual could get really long, but those could be things that you could look at with a flow chart where you could say, let's kind of trace that part out. How are we doing with all the little bits and pieces of that? Because the details are important, you know, especially if it's something that we do a lot, because we might be wasting a lot of resource or time. We could create an efficiency that will make us much more effective.
I do have to say we're really grateful with that, because whenever I started writing systems and processes, we had a volunteer. We have a volunteer, and she actually, I handed them to her, you know, and asked her, can you walk through this? And if there's any questions, or is it easy or difficult? And then by her doing that, she was like, she fell in love with it. She was like, I love systems and processes now.
Yeah, good. That's great. Yeah.
Like getting somebody to test stuff like that is good.
When people see that this stuff is useful and that it creates improvement and helps them to achieve their mission, they get excited and interested in it. When we first say, hey, let's do process improvement, a lot of people say, oh, please, I don't want to talk about that stuff. But then this is what this means. This helps me to do good work and help people and make a difference. Okay, good. Now I'm interested. I want to do this. I want to go to Chris before we run out of time here, because I know, Chris, you had your hand up.
Thanks. Yeah, I think my answer or my question was kind of answered just through you and Khalees talking, but I was just kind of thinking, I have never seen like a flow chart before until, I don't know, a couple months ago. And now I kind of love them. And so thinking about how to implement them for more processes, like, I'm just thinking, like, do we have like, not like a generic flow process, but like, because we kind of do some project-based things that have a start and an end time, would you have a flow chart like specifically for one aspect or as like a whole?
Yeah, that's a good question. I think flow charts are best as tools to hold a magnifying glass up to something and look at it in detail. I think that if it's it can be a sort of a standard process for how we proceed with our, what's our procedure, right? Policies and procedures. What's our standard operating procedure? Well, here's the flow chart picture to show that, or the steps in the sequence to teach people. So it kind of depends on the style and the culture of you and your team and how people relate. I think flowcharts are helpful to most people because the visual representation is usually more accessible than a lot of content. I always struggle with policies, for example, that just have these paragraphs of we'll do this and then we'll do this and then we'll do this. I mean, that's hard. I have to read those like 6 times before I really get engaged with it. But with a simple visual chart, you can teach people and people will learn really quickly. And you can see where the challenging areas are. Try to find the problems in a narrative policy, like where are the spots where there's difficulties. It's impossible, right? You have to just read it over and over and over, unless you're super familiar with that or have a high level of expertise in the content area. So I think, Chris, you can kind of experiment and see what works for you and your team and how much and how often you do it more, and then get the feedback from the team. How is this for you? Does this help you to understand this better and to think about it more clearly? So it's kind of very flexible. All right, well, we're just about out of time today. What I want to encourage you all to do is to think about that idea of the walkthrough and whether or not you can do a walkthrough or you've done one. Think about the idea of drawing a flow chart of a process, either something that you've walked through or just any other process that you're concerned about that you would like to improve, where you think you might have some desire to focus this work that we're talking about. Some of you already have some ideas about what you want to work on. And also think about the change team idea. Who are the people we can bring together to be a team, and who are the people who are best able to help us to work on this particular challenge or issue that we'd like to work on. So that's pretty much it for today. Any final comments, Chris? Any thoughts from you as we wind down?
Yeah, I would just say don't overthink it. Pick something small and just go for it, because this can be applied to a lot of different areas. So don't go for the top of the tree, like grab that low hanging fruit and write out the process for something super simple, because you start to see just how easy it is. Matt and I both work with the Great Lakes ATTC, and we do change processes like weekly. Somebody will say this form's too long. Let's do a change process on it. And we don't overthink it. We get our change team together, we do some work, and within 2 weeks, we know, oh, that was a good change, not a good change. So think of it like that. Like, this is a tool you can use really quickly. So this isn't for like, our organization is going to start repairing cars. We're going to go in a whole different direction. This process probably isn't the one to use for that. But for just like Matt said, where there's bottlenecks or you're thinking about changing something, like Khalees said, like something just isn't quite working right and we don't know where it is, this will be really good to apply and figure out where those areas are. But don't overthink it and don't go too big.
All right, good advice. Thank you for that, Chris. And thank
Ken,
you all for being here.
Ken, did you have a question?
Yeah, I said one comment to perhaps, since we're going to be together for a couple more weeks, maybe if folks, when they share, they kind of say where they're from or very briefly. So now I know that you work at Great Lakes ATC. So so perhaps there's opportunities for we're in similar life cycles, we're in geographic locations where there could be some networking and collaboration going forward. Since we're in the field together, it sounds like Lisa and I are pretty much in the same growth phase. So just something very simple and brief.
Good point, Ken. Thank you for that. We get a little more context as people share their ideas too. It helps you to understand people's comments as well, to have a little more clarity like that. So good comment. Appreciate that suggestion. So let's try and do that going forward, and we'll try to encourage you to share a little more detail so people know who's who and kind of what you're about and what you're doing. So thank you.
All right. Thanks so much, everyone. We'll be back next week, same time, same day, same link. and I'll send out a reminder email. And then remember that we have a landing page for all this information. We were able to get recordings, the session 1 recording up. And I will, unless Cindy just did it, I'll put the link again in the chat for anybody that wants to go there. It can just be helpful to review the information. It's where all the handouts live. And I'll put it in right now just in case so you can access it. But otherwise, we'll see you next week. Have a great week. You can always email with us with questions as well.
Thank you all. Bye-bye.